Charter of Need mantra of His Excellency Right Honorable Francis Nwifuru has been graciously demonstrated starting from 2023 November the 7th, when he approved the enrollment of the civil servants into Ebonyi State Health Insurance Agency.
Sincerely, I am very delighted to be in your midst today for this all-important Ebonyi State Health Insurance Summit, with the theme advancing universal health coverage through a sustainable health insurance mechanism. First, I wish to express my profound gratitude to all of you for joining us here today, distinguished leaders of our states. So, on behalf of the government of Ebonyi, I think it's wise for us to take the responsibility of paying for the civil servant for the health insurance scheme.
It was a great feat. On the 29th of April 2024, His Excellency, through the Deputy Governor, came and flagged off the service utilization of this. All the civil servants started going to different hospitals whenever they are sick, utilizing services. Now, we saw a need that a lot of people do not have chance to go to the hospital. And we have to walk through the head of service for many people that have sight problem, many people that have fibroid problem, many people that have a hernia problem, to come together and be evaluated by health experts so that we know how to help. In this program, we inculcated checking of sugar to know if there's anyone that is diabetic, checking of their BP to know as many as them that is hypertensive. We did all this evaluation and have a proper outcome. During the enrollment, many people came from different places and got themselves enrolled for this particular intervention, the surgical and the medical interventions for Oma Healthcare, which is the civil servant of the state.
Several medical interventions for the civils and public service, which includes eye surgeries, eye care, hernia surgeries, fibroid surgeries, to mention but a few. Our governor has been phenomenal in giving to the civil service.
The message to the civil servants is that they should thank the governor. Now they don't have that reason that why they did not go to hospital is that they are waiting for salary to be paid. What you need to go to hospital now and be attended to is just your enrollment card.
We want to run a city, a state, a universe where people can come and have any access that they need in terms of health care. And after accessing that health care, they shouldn't be poorer.
Of course, you know that I should be smiling from ear to ear. It's a very welcome development. It's an opportunity for Ebonyi workers to get treated and smile home and feel the impact of government.
You know, we recorded 582 persons that came for this intervention. This is marvelous. These people ordinarily wouldn't have gone to the hospital. And this is why most times we hear that somebody slumped somewhere and died. The person is actually sick but had not had opportunity of going to the hospital. Now we made that enabling environment available for these people, and they came, checked themselves by professors of medicine. When we finished checking, those that we identify that have sight problem through the sight screening, amazingly, almost all 582 persons had sight problem that needed glasses. We issued 582 glasses to them.
Today, I have picked my own eyeglass. I'm so happy because I've been having this eye problem for long, but chance from office, finance, and so many challenges. I've not been able to go for the treatment.
The first time in history in Ebonyi State, making all the civil servants to have this great opportunity. As you can see, I'm wearing my own, showing that everything is true. It's not a fabricated story.
The screening was perfect. And you can see I'm wearing the glass. The glass is too fine.
We didn't stop there. Those of them that had cataracts were sent for surgery, cataract surgery. Those of them that had pterygium were sent for pterygium surgery. Those of them that had the glaucoma, we did them laser surgery. And all this were done. All because of the People's Charter of Need of His Excellency Right Honorable Francis Nwifuru. I tell you the truth, it is only in Ebonyi State that a civil servant is enjoying free health insurance. There's no other place. I have connection to almost all the states in Nigeria. There's no other states that can say that. They do what we call co-health insurance, which simply means that the civil servant will pay some percentages, the government will pay some percentages, but here in Ebonyi State, we are paying the total 100% health insurance, free of charge, paid by the state government, by the approval of His Excellency Right Honorable Francis Nwifuru.
My name is Dr. Oji Michael. Yes, I'm an optometrist. I think in general, we appreciate what the governor is doing through this process, this EFSHA program.
My name is Professor Chimdea Obonnaya. I'm happy to be of use, to help Ebonians regain their vision. The EFSHA sent a number of patients with serious eye conditions. Some of them had cataract, some of them had pterygium, some of them had more complex cases. Some of them were cases that have overstayed, probably because they didn't have financial help to get it sorted out. But today, by the benevolence of the governor through EFSHA, they've had their surgeries done and I'm sure they are happy.
August, nwanyi bi umahia, baronga umahia, sikaga lemanya. Agara mebe ahụ bill ha nyere sikeme operation one eye. Ofu anya is 600,000. Owe ebe gode. Abụrụ onye Chineke jiri gọvanọ anyị rọpụta eme manya be nwere onwe. Ọ kapụkwara ofu anya a ga-emekwa on Tuesday.
And you can see I'm sounding sound and quite promising.
I'm being operated by two eyes. It's not an easy thing.
This is the first of its kind. Honestly, this is the first. Yeah, Ebonyi State is blessed. Other governors have done their own, but this particular governor, his own is what I cannot say because I'm just full. My heart is just full of joy.
We'll give kudos to our governor. He has done well.
Now, through the same intervention, we were able to harvest about 49 persons that had hernia, and they did their hernia operations. And they got themselves free. They are rejoicing, they are happy, they are testifying. Some of them say that they had this issue, but they don't even know how to go to the hospital because they don't have money.
I've been living with hernia from birth. I am 43. So the hernia is what they call a umbilical hernia. Doctors told us that we need to perform surgery and remove it, but we have been finding it difficult to get money for the surgery. Not until His Excellency, the Executive Governor of Ebonyi State, decided to give us free medical on the program called Onwa Health Care Program.
I'm Dr. Edech Puma, a specialist surgeon.
My name is Dr. Mezruke Daniel, the consultant general surgeon.
My name is Dr. Awu Augustine. a consultant.
My name is Kenneth Ishale, specialist in anesthesia.
So we want to appreciate our governor for what he's doing for our people. We've not had it so juicy like this in the recent past. He has remembered us very well, remembered our people that are suffering in the hinterlands, and even those living in town here that cannot afford to pay for all these medical services.
And I agree with them. Now, the angel from above, His Excellency, had enabled them to get this done. What of those of them that had fibroid? Majority of them came saying that they went to the hospital, they have been charged almost like 700,000 naira for this operation, but now you can see it. They had that operation, nobody collected any form of money. In fact, there's one woman that was operated and she took about 5 pints of blood before and after the operation.
My name is Dr. Mabnike Ukeke, a consultant obstetrician and gynecologist.
I am Dr. Nyekelu Emmanuel Olisa. I'm a consultant obstetrician and gynecologist.
I'm Dr. Onwe Cletus Yu. I'm a consultant anesthetist. I'm here this morning to anesthetize these patients in the ongoing surgeries that is being organized by the state government of Ebonyi State.
I received the surgery because I'm having a problem of fibroid, but now I'm giving testimony. My blood did not reach to the point of receiving the surgery because it was very, very low. So this blood I'm taking now is making it 4 points of blood.
Because her PCV was 17%. We have to start transfusing this woman before the operation and transfuse the woman after the operation.
This fibroid for many years. I got a hospital, even got a hospital. Doctor said that I will punya. But I'm going to go. I go me back 2 times. But I'm going to go engage with you. Because asimunu, so don't kele Chineke. Maybe wokano. Wokano aga chigide. This is our governor. Onye obuna ga apụta. Sino ko bia noro. Kono ya ga apụta for second tenor. Asim Holy Ghost fire.
Today we have been since morning till now. I have been visiting hospital from one hospital to another hospital in supervision, seeing those that have been operated upon. We have seen lots of fibroid cases. Today, as a medical professional, it's my very first time to see a fibroid that looks like a baby, as big as a baby. This fibroid has stayed almost like 20 years unoperated, and the lack of operation is because there was lack of funds. But the governor of Ebonyi State, through Ebonyi State Health Insurance Agency, has been able to give a waiver for all the civil servants that may need these interventions, and this has given relief to our people. There's joy everywhere. Relatives are smiling, the beneficiaries are smiling, and every other person is smiling just because of the work that the government has been able to do. All I can say in this is that it is like the biblical injunction. When the Bible talks about Jesus Christ and say how God anointed Jesus Christ of Nazareth, who went about doing good, healing those that were oppressed by the devil because God was with him. The governor of Ebonyi State is going around doing good, and that is why he has people's charter of need.
All these things were not paid for by the person, but paid for by the health insurance. as made approved by His Excellency Right Honorable Francis Nwifuru.
I'm quite impressed with what I have seen here today. The objective of this visit is to confirm the civil servants that are beneficiaries of this program, to know whether they have been duly operated on, whether the assignment that was given to EPSHA to have them after enrollment to actually benefit from these surgeries, whether this has been done. And I must say that I'm impressed.
This is governance, driving democracy and governance to the people that you govern.
Giving our gratitude to the Executive Governor of Ebonyi State and his dear wife.
I'm particularly quite grateful to His Excellency the Governor.
I want to say a very big thank you to our amiable governor, to can-do governor.
I want to also appreciate His Excellency the Governor of Ebonyi State, Right Honorable Governor Francis Nwifuru, for the opportunity and the privilege given to us, especially with the civil servants.
Thank you, Excellency.
Very soon, time that is not far from now, Ebonyi State will be the best implementer of health insurance and health system entirely. This is because we have a governor that has good health policy. That is why now they have recommended him for Health Priority Award. And that is my happiness.